Edutainment Studios welcomes you to Pre-Pregnancy Planning, Healthy Pregnancy. This module is part 2 of a 4-part series on pre-pregnancy planning. Having a healthy pregnancy begins before you actually get pregnant. This module can help you work on becoming as mentally and physically healthy as possible before you start trying to get pregnant. This increases your chances of getting pregnant and having a healthy delivery and baby. In this course, the objective is to help you apply the benefits of starting healthy habits. It is usually easier to make healthy lifestyle changes before you get pregnant. Since the exact time of conception is usually unknown, it is the safest choice to begin these changes as early as possible and to try to maintain them throughout life. The best way to begin a healthier way of life is to eat a balanced diet. When you are pregnant, the baby is fed by what you eat. So, eating a healthy, balanced diet will give the baby the nutrients that they need to grow and develop properly. Also, eating healthy before becoming pregnant may reduce the chances of having trouble conceiving. The focus should be on eating fruits, vegetables, whole grains, lean meats, and low-fat dairy products. These types of foods will give the baby the special nutrients needed to be healthy. You should avoid any intake of artificial sweeteners and junk foods that are high in sugar and fat. These will add extra calories while giving both you and the baby very few nutrients. A balanced diet can provide nutrients needed before and during pregnancy and should include leafy green vegetables, fruits, beans, yogurt, fish, milk, and eggs. Prenatal vitamins are usually prescribed by a doctor but can be found over the counter. Ask your doctor to recommend or prescribe one. You can also browse the local drugstore for a prenatal vitamin that contains all or most of the nutrients and then confirm your top choice with the doctor. A regular multivitamin and a healthy diet alone will not usually give you all the nutrients needed when pregnant. You must also be sure to include folic acid, iron, calcium, vitamin D, omega-3 fatty acid, and iodine. Staying active before and during pregnancy has many benefits. It can make labor easier on the body, help reduce backaches and constipation, lessen the chances of swelling, increase energy, boost your mood, and help with sleep. It also helps prevent gestational diabetes during pregnancy and makes it easier to lose weight and get back into shape once the baby is born. It will also be easier for you to stick to an exercise routine post-delivery if you are active before you get pregnant. Activities such as walking and moderate aerobic activity are easy to start with. Aim for getting at least 2.5 hours of exercise a week. This can be broken down into 30-minute sessions 5 days a week to be easier on your schedule. Do not be discouraged if you achieve less than this, as some activity is better than none. Check with your doctor at the pre-pregnancy visit to make sure exercise is safe. Being overweight or obese increases the risk of high blood pressure, diabetes, and other problems when you are pregnant. Your pregnancy is also more likely to be uncomfortable and labor may be longer. Ask the doctor what a healthy weight range would be for you. If you need to lose weight, an eating plan can be designed, but you must include exercise. Being underweight can make it harder to get pregnant and increase the risk of miscarriage. This also increases the chances of having a baby with a low birth weight or born prematurely. If you need to gain weight, eat 3 meals a day plus snacks and add healthier foods to each meal. It would also be helpful to drink juice and milk for extra calories. Stress can actually affect pregnancy with physical symptoms such as headaches, increased heart rate, and irregular menstrual cycles. All of these factors make it harder to get pregnant. Once you do become pregnant, ongoing stress or anxiety can affect the baby's development. You can reduce the effects of stress on your body and mind with relaxation techniques. These can include deep breathing, meditation, yoga, and massage. Try out different techniques and make your favorites a part of your daily routine. It is also imperative to get enough sleep. Being overly tired can increase stress levels. If you are having trouble reducing stress on your own, the doctor can help. Learning about pregnancy and childbirth will help reduce any fears and anxiety you may have while increasing your confidence about the healthy choices you are making for your baby. It is important to get any information from trustworthy sources. The doctor can recommend helpful books and websites. Your menstrual cycle will need to be discussed, and you will have to track this in order to understand when you are ovulating. Ovulation is the best time to have sex in order to get pregnant. A simple log can be used to record the dates when you get your period. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 2 of this 4-part series on pre-pregnancy planning, and please join us for Part 3.